So where is this all going to? Remember the one concept that we said in the very beginning from Georgia? Cradle to grave, tomb to womb, womb to tomb, sorry, womb to tomb. One of the first districts that were used was the Farrell Area School District that was used as the model for community service systems, where the federal government, the local government, and the county government, state would all come together in collaboratives and filter money into a district for community services. They called it the Prescription for America. This is your health care link. The key is that the national health care will merge with anyone not meeting outcomes in the community. The Farrell District is near to Erie, Pennsylvania. They redefined family, any person or persons who have a common bond of shared responsibility for each other and or a child or children in their care. Now, if that's not what you think your family should be, I would suggest that you hop on the word partnership real quick, because they mean to take control of not only the children but of the community. And the time is short. I believe that we are on the edge of the cliff, ready to be pushed off. But as you know about dominoes, you can always push them back, and they could head the other way. Here is the outreach plan. You have your school-based center where all your mental health, preschool, talent search, instructional support team, family health clinics, and everything else revolves around the community center. This district was taken to the National Governors Association in 1989, when then the governor of Arkansas, William Clinton, had initiated the system. The district's motto, Care and Education for All, may be the Prescription for America. This key model was pronounced as Pennsylvania's school for the 21st century. This is what schools will look like in the future, community-based services. And the National Association of State Directors of Special Education said, remember that it's not all children, all citizens, one-stop shopping, one-stop support. And one of the key is your comprehensive health care and intervention services that would be located in the school. Everything would have to be mastery learning, outcome-based, and that you would have the multi-agency-based services, including recreation, including transportation, including food, including everything that touches your life. This is governance. The whole idea is that in order to have a comprehensive community service system, you have to have your state government break it down into pieces where you have county human services, school districts, and your health care systems come together in the school. But realize that it's going to be county level of organizing the system. It'll be through your county commissioners for funding, because now we are going to be forced to have that, what they call a client registry. Because as you have the collaboratives, as you have the interagency approach, so that we are not going to duplicate services, we have to monitor the individual in the system and monitor services coming into the school. And this is where we come into the aspect in Pennsylvania where they call the Children's Cabinet. And realize that all of your collaboratives, remember parents are just one piece of the team in this service system that will be in the center. The way that it functions in order to target all children is through student assistance, which is being developed through your special education. So you have the regular education and your special education coming under the same system. You have your single points of contact, which are going to be mental health. Remember the quote this morning by Dr. Pierce from Harvard, all children going to school are mentally ill. It is coming true. All children will be targeted for mental illness. Interagency Coordinating Council, you have children and youth, drug and alcohol, and also with your mental retardation. So you have your main social services coming in. You have Children's Services, Department of Welfare, Mental Health and Mental Retardation that will be coming in, joining these collaboratives to be sure that the children get their services. You have Juvenile Justice, Women and Children, and Job Training. So now we have education, health care, and labor, workforce training, merged into one system within the state. So you're going to say, well, gee, I don't understand how it's going to work. How is this going to function in the system? We've been following the Medicaid very closely since August, when the big push for the national health care came in. And what were they saying? We've got to protect the Medicare. We've got to protect Medicare. So you had universal services, right? You have your universal coverage for the employee mandate. And this is all they were talking about. Were they talking about spouses? Were they talking about the children? No. Employer-employee mandate. As this was going on, what was being put in place through the Department of Welfare, Children's Services, and Mental Health and Mental Retardation was a system that would fund age 0 to 21 all health care and all mental health services through the school through Medicaid. Medicaid comes under the Medicare banner. Protect Medicare was the banner because this system has already been put in place and has not touched your legislatures. Through the federal government, it's called the OBRA legislation of 1989. And what it set out specifically to state was that Medicaid was going to be used to support community-based services, and that they were going to redefine that role in Medicaid. They were going to break the conceptual lock to be sure that we would go beyond the strict definition of medical care. So anyone who was, quote, medically needy under the IDEA grants, and this is special education, the Individual Disability Education Act, would now qualify under special needs. So now you had a system that would be able to be used for community-based services. And the first would be that under the OBRA legislation, the Omnibus Reconciliation Something or Another Act, it said specifically that for every dollar in the mental health that the feds would put in, the state by law would be forced to put in a matching dollar. So what was happening was that because of the mandate, they were forcing services, but expanding those services to anyone who was special ed. Well, you'll say, well, don't you want those children in the wheelchair to have services? You're in the traditional paradigm again. Remember what I said about special education. No one is normal. Everyone must meet outcomes. So the system was pulling in anyone who did not meet outcomes were going to be labeled under special education, under your Georgia special assistance. So once you had a child who was going to be screened, and remember, all children would be screened to see if they were at risk. So now every child was going to be logged onto a computer saying where they were in the system under special education. And because of federal reporting requirements, this by law had to be reported to the federal government. So now all children are labeled at risk. And even if the child was in remedial reading under Chapter 1, they would have a, quote, language deficiency. They would have an impairment under special education, which would allow them to be funded by Medicaid. Okay, so all these children are now, under special education, are able to be funded for special needs. Once that child is labeled special ed, now they are labeled disabled under Medicaid. What is the criteria for Medicaid? It's called EPSDT, Early Periodic Screening and Diagnostic Testing. It was case management, clinic service, rehabilitation, special education-related services, personal care, and home and community-based waivers. So under EPSDT, Early Periodic Diagnostic Screening, we were able to screen every child, which would now be funded by Medicaid. Now, what happens to that regular teacher in the classroom? This is called time management, where you have the screen and match. The teacher was going to be able to do everything they normally do in the classroom, but it was going to be funneled under time management, under health-related services. Every elementary teacher could come under time management, which meant that, well, see, now you have this medical assistance child who is eligible for Medicaid, but you also have the medical assistance enrolled, or the Medicaid enrolled. These were the children who met the income level of below poverty. Those are your enrolled. But you had the eligible over here who may be eligible because of special ed needs. At that point, you didn't have to be indigent to be able to come under Medicaid. All you had to do was show a need. So income no longer is the barrier to get Medicaid under SSI, Supplemental Security Income. So now all of these barriers are removed, and you have a perfect system under medically needy and mental health needs being implemented in the school. Now, what about case management? Well, you know, if you have the traditional family, Ozzie and Harriet, and they go into school and they say, you know, I don't like this test, and I don't like this curriculum, and I don't like what's going on in here. I don't want my kids hypnotized and laying on the floor and doing these weird things. I just don't like it. Well, Ozzie and Harriet, you are being very unflexible, and you are not cooperative, so we're going to have to do an individual service family plan in case management that will be funded by Medicaid, which will allow the government to step into your home. You will have to go to parents as teachers. You will have to go through the training to be sure that you are not a dysfunctional family. And if you do not meet the outcome, we have this great big list of foster care that will be glad to take your children from you. So the whole idea of case management, monitoring the family, are at our doorstep. The implementation of a national health care system that are going to target dysfunctional families through culture, through what your nationality is, what your race is. So if you are black, on this paper that I have, it says that you are dysfunctional because there are certain things that blacks believe. If you are Italian, there are certain things that Italians believe, and you are dysfunctional. In fact, it had all of them on there except French. I couldn't really understand it. So the whole idea is cultural dysfunction. The whole idea is that everyone will be functionally not able to normally be in this system. And the incredibility to it is that people out there implementing the system, I always call them the Stepford aides, because a lot of them are very young, not very experienced, implementing a system that they only know this much about. And they don't have the total picture of when they say that they can come into your home and do certain things, that they can say other things can happen to your children without your consent, the psychoanalyzing, everything that's going on in medical care. Do we have something to say about it? The very last piece of this is, how will this implement your child's record? What we found is under the psychosocial stressors, it said specifically, and this is on page 179 in the New Managed Economy, Womb to Tomb, one of the books that take you through all these documents, and it says specifically that EPSDT can either be used for expanding outreach activities or screening for psychosocial risks. So you have to ask, well, gee, what is a psychosocial risk? And we had to go to the criteria of how they were going to determine a mental disability. And under a psychosocial risk, it said specifically that one of them could be a stressor, would be breaking up with your boyfriend or girlfriend or having a fight with your family. Now, the key to this is that once you are pulled into the system and your child is targeted as special ed, first of all, the district must provide the service, and you will come under Medicaid whether you want it or not. Now, once your child is targeted, what will go on his record is a DSM code, Diagnostic and Statistical Manual 3R, which means anytime your child is targeted for one of these outcomes in the mental health area, a code